in the late 1800s. The physicians had a stranglehold and basically controlled our system, our healthcare system. So they basically controlled it through medical or medication information. So by controlling this information, they also controlled the outcomes and the treatments that patients would have. I'm a nurse. I've been a nurse for over 6 years. I have both bedside clinical experience and administrative home health care experience. I've done a number of webinars, seminars, CEUs, ranging from rules and regulations of Medicare to patient safety, patient education, patient advocacy. I firmly believe in patient advocacy, and that is why I'm speaking on the topic of informed consent. A lot of times nurses and doctors will get together, and doctors will hand the form over and say, hey, go get this signed by the patient. Patients will erroneously sign those documents because there is a both professional and level of trustworthiness, I guess you could say, and between, in the healthcare relationships between a nurse and a doctor and their patients. And then we would just never doubt as nurses in the healthcare profession how much we value, and we are patient advocates, that they didn't fully disclose the information to their patients. So they need to tell you, one, what your condition is. You'll probably know the name of the doctor. That's listed in some state laws. They differ from state to state. Two, what the outcomes of the procedure or treatment are, risk associated with it, and alternatives to that. Like I said, it'll differ from state to state. You want to make sure you have lots of question and answer time to go over with your doctor, and then if you have family that's also involved in your care, if they would also like to be a part of that. We have cases dating all the way back to the early 1900s, 1904, in regards to the different kinds of laws that have actually developed from, bioethics and legal cases. The right of informed consent, Justice Cardozo is often quoted in bioethics and legal literature that, every human being of adult years and sound mind has the right to determine what shall be done to his or her own body. So, that's basically the rights of informed consent in 1914. Up to 1972, well-known case, Canterbury versus Spence, where the patient claimed he wasn't adequately warned about the risk of a back surgery where he became paralyzed. Their view is that the patient's right of self-decision shapes the boundaries of the duty to reveal, so it still falls on the physician. Your physician is the main person, the only person that can actually educate on informed consent, that can educate the patient, which means that the nurse is not able to do it. They can't fill in the gaps. If they do, they're opening themselves up to great liability. All of this in informed consent, all of the pillars and basically foundation of these theories and concepts come from the 5 pillars of healthcare professional duty. Benefits, non-maleficence, autonomy, which is a big one, which is closely associated and one of the core foundations of making decisions in the United States healthcare system. Autonomy is, which lends itself to self-determination. It's also, used synonymously, interchangeably with autonomy. It's the philosophical basis for informed consent. Patients have a moral and legal right to determine what will be done with their own person, to be given accurate, complete, and understandable information in a manner that they can facilitate judgment, to be assisted with weighing benefits, burdens, available options in their treatment, including the choice of no treatment, if that's their choice. They can accept, refuse, terminate treatment without deceit, undue influence, duress, coercion, or penalty, and then be given necessary support by the healthcare professionals through that decision-making process and treatment process. Such support would include an opportunity to make decisions with family and significant others. Nurses are big patient advocates. They are the witnesses to this to these documents, but it's not just a document. Informed consent does not just mean you're signing a piece of paper and you agree that, and then there's no legal ramifications if something were to go wrong. There's still a plethora of things listed throughout time in different cases that can basically tie the patient and physician relationship to that fiduciary contract, which is basically, held one of the highest, oh word, principles. Goodness, sorry. So based on the patient's beliefs, values, treatment alternatives can be rejected or embraced. So the essential fundamental patient right to consent to medical treatment and that ethical principle of autonomy gives the foundation for the belief that the patients are given the authority to evaluate the medical treatment on the foundation that they have choices. So the consent was historically given through common law decisions, and early court decisions gave some guidance to healthcare professionals on how to comply with requirements for consent. But that significant case that Justice Cardoza spoke to was in 1914, and then after World War II, there are some other things that came into place, some other acts that further supported how human specimens will be treated in even clinical trials. So that was added to what informed consent had to be given for. The United States has a history of doing some pretty scrupulous and suspicious activities in regards to treatment. The CDC spokesperson once said in regards to something that was called out about Guatemala and informed consent not being given over there for STDs that these people had. Well, we couldn't do that to white people. Oh, goodness sakes. And the codes after World War II, it's the Nuremberg Code. So, nurses are huge patient advocates. They're on your team as, on the patient's side to make sure they are given truly informed consent where they understand and agree they're given all the proper information. You need to be told it's the duties on the physician to explain the procedure, the possible risks, the alternative therapies in words that you can understand. They can be liable for lack of informed consent. They can have a few other theories that can be related in terms of how the act took place and what resulted from the harm. So they have a duty to disclose of what's reasonable, what any reasonable, prudent physician would disclose under the same or similar circumstances. So customary disclosure practices, you'll hear that sometimes. The nurses, their primary duty is to witness, to make sure the patient does understand, and then the patients actually have their own rights and responsibilities too. So it's no more just handing a nurse a paper and having the patient sign. It's assessing the patient's interests and protecting and preserving those interests by assessing their understanding and of their treatment and options and information that's presented to them, and getting that done in a timely manner prior to giving them medication and knocking them out for surgery. So I hope you've learned a little bit, and we'll get back to you later. Take care. Bye.